Check, check.
Hey, bud.
How are you today?
I'm good, sir. How about you?
Not too bad. No particular speaker today. I wasn't able to confirm her, so she'll be next month.
Okay. Let me
John,
let me
right?
shut my off. Let me shut my office door. Very good. Who was supposed to be your speaker?
It's going to be a lady named Melisha. She works in Reentry, but I wasn't able to get her this month.
Okay.
Should be a good speaker. We had some other speakers. Michelle Forbes was the one we were supposed to have, but she's unable to make it. She was out of the country for a while and wasn't able to make it back in time. That was going to be a good one, but we've got a good list lined up. It's just this month
Okay.
didn't work out.
I don't think we've met, have we?
No, I talked to you on the phone though.
Oh, okay. Okay.
A while back. You gave me the password. I think it was like a couple months ago.
Yeah.
Nice to meet you. It's John, yes?
Yes, Jonathan.
Nice to meet you, Jonathan. So, Jonathan, I was thinking, like I said, I don't particularly have a speaker, so I was kind of thinking about talking a little bit about what I do here at RRD Behavioral Health with people in
Okay.
reentry, unless you had a different idea.
Oh no, that's fine. I know we've been getting a lot of different people attending that do a lot of different things.
Yeah, I think it's a good uptick. What I'd love to see seriously are the people that can benefit on these calls. I would love for it to be the actual endpoint. Some of those people to be on the calls just to find out. I mean, a lot of these things people don't even know exist. So
Exactly.
that's kind of my next step.
I didn't really know. I mean, I knew about the reentry councils because I've known Bev since 2023.
Okay.
But I didn't really know about this side of the reentry councils until I started working with Reach.
Okay.
How you doing, Scott?
Pretty good. How about you?
Okay. Still got about 4 minutes here before we start, so we're just waiting on everybody to get on.
Is everybody staying warm?
Yeah, it's trying to.
Crying
I
is the
think
word.
oh,
I'm sure it's probably a little bit colder up your way than it is here in Logan. So,
it's supposed to get up to 47 today. So I'm hoping it does. Yesterday was a whopping 19. However, down in Logan, you guys are supposed to be slammed this
I know,
weekend.
I know. Me,
Yeah.
me and the wife, me and the wife done talked about it. If we get hit, we ain't going nowhere.
We're supposed to get hit up here in Clay County too, but it's like it all just depends on how far north this storm comes, where it's coming up from the south.
We've already told all the kids, grandkids, get what you need because we're not going out. We're not doing anything.
Yeah. And I just looked
Only
up the
only good side is I get to try out my snowblower for the first time.
I could see why you would be excited about that. My husband is hoping that we get the snow so he can go play with his side by side.
Oh,
That's what he wants to do. And I just go, okay, honey, you have fun with that. I'll be here under blankies with a book.
all right. 10 o'clock there, Barry.
Thank you, Jonathan, and I appreciate everyone showing up today. It is 10, and we're going to go ahead and get started. This is the West Virginia Reentry Council for Northern Central West Virginia. We serve Elkins, Randolph, Tucker, Upshur, Lewis, and Braxton counties. I'm your chairperson today, Mr. Barry Lee Pace. My co-chair, Samantha Ryan, should be on her way. Her daughter had an eye appointment this morning. This is the first session of 2026 for January of our West Virginia Reentry Council. It runs from 10 a.m. to 11 a.m., and the sessions are every third Wednesday of the month. The REACH initiative is committed to seeing each individual healed and restored. That includes body, mind, and spirit, so they can successfully live out their lives. Through the establishment of a statewide network of reentry councils, we seek to bring about lasting change and collaborative impact in our communities. And the work that we do is based upon the compassion that we show for our fellow brothers and sisters in their suffering and needs. And we, of course, believe that each one is worthy of dignity and respect. Of course, I want to take a couple moments here to let everyone get to know each other. We're just going to go around the room, take care of the introductions before we get started. So that you know up front, our speaker was not able to make it today, and our confirmed speaker cannot join till next month. She's very involved in reentry. I'm super excited about it. But today, really going to talk to you myself a little bit about what I do here with behavioral health and reentry. But first, let's go around the room and get our introductions out of the way. I'm going to go ahead and pass to Ms. Tanner.
Hello, everybody. My name is Aaliyah Tanner. I am from Disability Rights of West Virginia. We are the federally mandated protection and advocacy group for people with disabilities. A good rule of thumb is if you have a disability related issue, to contact us. Even if it's not something that we specifically deal with, we can get you on the right track to get to the agency or the group that you do need to be working with. I specifically work with Division of Rehab Services, which is vocational rehabilitation. And I work with individuals that receive Social Security benefits that have barriers to employment. I did put our website and our main phone number in the chat, and I recommend anybody going and everybody going to that website. We have loads and loads and loads of resources for people completely free. Everything from a nonverbal communication card that uh, offices. I'm kind of the opinion that everybody should have one of those nonverbal communication cards in their first aid kits, in your office, and first responders. I mean, anyone and everybody. It is a PDF. You can print it off. There is also a nonverbal visor card that is geared for individuals with a disability to have if they get pulled over by the police. So it on one side it has questions of, I have hearing impairment, I read lips. It's different images they can point to communicate with the officer. And then on the flip side of that visor card is questions that the officer can then ask the individual, like you have license registration, you have a light out, search the vehicle, things like that. Just to Those types of things are really good aids for people to use to keep miscommunications from happening. But we also have a lot of other resources on that website. If you guys have any questions, always feel free to reach out to me or reach out to us, and we'll try to assist in any way we can.
Thank you so much, Aaliyah. I'm going to go ahead and call on Mr. Scott Trudell. And Scott, when you're done, please pass it to the next person.
Hi, I'm Scott Trudell. I'm the Community Engagement Specialist at Appalachian Community Health. I try to facilitate all our programs to help our individuals and help them with their mental needs and help them get back on their feet. I'm also the community engagement for Celebrate Recovery up in Buchanan. And basically, like I said, I just help facilitate all the programs together and help our clients live their best lives. And I will pass to Jillian, I guess.
Hello, I'm Jillian Kennard, and I work for WVU Medicine Healthy Minds here in Clarksburg, and I'm the peer recovery support specialist for Tigard Valley Regional Jail. And I will pass to Aaliyah.
She went already.
Oh, okay. Jen.
Hi, everyone. My name is Jen. I am the outreach coordinator for the crisis units at Northwood Health Systems. We're located in the Northern Panhandle in Ohio County and also Brooke County, which is Wheeling and Weirton. We can admit for detox and also mental health stabilization. We're open 24/7. We take referrals from all over the state. So I do like just to come on the meetings to let everyone know. If you have any questions, I will put my information in the chat. And I will pass it to Ayla.
Good morning, everyone. My name is Ayla Matthias, and I am with Aetna Better Health of West Virginia. I am a part of their social determinants of health team. I cover the top 32 counties. I am also a member of the stakeholder meeting, which is for Healthy Minds, that has a QRT in, hold on, Lewis, Braxton, Gilmer, I believe. So anyway, we have meetings about once a month. If anyone wants more information about that, my email is in the chat. Thanks so much.
Is there anyone else that didn't go? I don't believe so. Jonathan, if you'd like to mention something, please feel free.
Well, for those that don't know me, I'm Jonathan Spence. I'm with the Reach Initiative. I'm also the Community Reentry Engagement Specialist as well as a Reach Back Navigator. I'm justice impacted. I'm also a part of the Criminal Law Reform Coalition. Uh, so I do a lot of advocacy work as well. Uh, right now I am I do all the Zoom meetings for the reentry councils. So if anyone would ever need anything put out on Constant Contact, you have an event coming up in your area and you would like to get flyers out to our contacts in that area, please feel free to send me an email and I'll put that in the Constant Contact, send it out.
Thanks, Jonathan. Definitely appreciate that. And again, my name is Barry Lee. I'm the chair here for our meeting. I also work in reentry and substance use disorder. So a little bit about me. In my past, I have worked with individuals really on my own that were coming back into life, I should say, from incarceration. This is something that I've had a great passion for a long time. I am a reentry navigator. As I've stated, I'm the chair. I'm the former assistant director of Lighthouse Community Recovery Home in Elkins, West Virginia. That was a men's sober living home. We work with individuals with substance use disorder to help them to root their lives in strong values, strong principles, and of course, to work on their ethics and self-esteem so that they do not repeat some of the things that have happened in the past. I'm currently working with RRG Behavioral Health that has two locations, one location in Huntington, West Virginia, and the other location is in Elkins. That's the office that I'm in right now. I am the front desk administrative assistant here. I also still work very closely with the sober living. So what's happened is that the sober living itself has merged with a subsidiary of RRG that's called Horizon Recovery. So that sober living still works. I get quite a number of people. I have a meeting right now. There, it's called IOP, which is the intensive outpatient meeting. We have about 11 gentlemen, and we have four ladies from a sober living that maybe you've heard a little bit about. Allie's Hope that opened here in Elkins just recently. Shelby Wilson is the owner of the facility. She's very, very, very active in the community and also with St. Joseph's. So she's opened her sober living. We're doing intensive outpatient work with the ladies here and the gentleman from what is Lighthouse at Horizon Recovery now. And being in this position, I've been thinking about it a lot. I loved reentry. I have a lot of peers around me. I have PRSSs and such. But that front desk job, it is literally the front lines. I get calls from everything from maybe Jillian's calling me about someone that needs placement, or it's someone that's just getting out of jail. I get a lot of case managers and such that are calling me to set up these appointments. And there are some things that we're running into. It's connections to reentry. I'm sure we're all familiar with that. But when they get out, I would say I'm pretty good at jumping right on top of them, but I would say maybe there's about 30% that I'll set it up with the case manager and I'll never see the individual. And we know that that's a problem. There's not a whole lot of support. That's why the tablets in jails are so great that they can get with a peer or get with someone that's going to help them as a navigator before they get out. Another issue, and I'm dealing with that this morning, and I'm so glad that we have Ms. Matthias from Aetna on here. We do work with Aetna Insurance here at RRG, but many times it's going to be an insurance issue. When they come out, they don't always turn the insurance back on like they used to. That used to happen every time. Doesn't happen all the time. We have to kind of get into the navigators to get their insurance turned on. By that time, they've run back into the same circle they were hanging out with before, and now here's a new charge. And we never even had a chance. The other thing I'm running into is housing. Housing isn't too bad for me because of the sober living if they have substance use disorder. I hate to use the word lucky, but unfortunately, many of the people that end up incarcerated, they were under the influence of some type of substance. So that is a good thing that I'm able to help them to get into Horizon and or refer them to other institutions. But regular housing is very, very tough here in the area. It's always a challenge for us. We've been doing well though on clothing donations. So we do have some sort of a clothing closet that we work with out of the sober living. We're able to help people with clothes. We have some blessing bags here. We work closely with Celebrate Recovery. Not only Mr. Scott Udell, who's on the call, but also another individual named Mr. Tolson, who is the leader of our Celebrate Recovery here at Elkins. The other issue that I do, sure, sure, Miss Matthias. The other issue that I run into that's really difficult for me is individuals that have some type of a sex crime. Now, I do work with those individuals to get them placed, but it is super, super difficult. I literally have a gentleman right now. He's related to a lawyer. We still can't find him a place to go. So why I'm putting all this out there is that I think that the efforts that we're all doing here are fantastic. However, I'm kind of asking, does anyone have any type of feedback or information, especially when it comes to Aetna or a better way that I can help individuals to turn on their insurance once they come out? And I'm kind of putting it out to the floor. If anybody has any suggestions or information, I'd be very happy. Hi, Miss Brown. How are you? So if I could, Miss Matthias, I'm going to unmute you. If you could tell us a little bit more about Aetna, that'd be fantastic.
For sure. So Aetna is one of the managed care organizations for the state of West Virginia. The super cool part about Aetna is we cover all the foster kiddos and all the CSED, so that's emotional high need kids. So they all have case management. The other thing that we do through that's Mountain Health Promise. Mountain Health Trust is our adults. And there are programs where they can have case management as well. And I would think that reentry would be, especially with substance, would be one of those things. All pregnant women have case management through Aetna. That's a big one that people don't know about. The biggest barrier is the address part, right? And making sure that people are updating that address with the department. They can call into Aetna and update it there. That's great. But our system doesn't work in reverse, right? We can get the address from the department. The department can't get the address from us. I don't know. What else would you like to know?
Well, that was good information. I guess the main thing that I run into is with an individual that doesn't have insurance at all. And let's say that they wanted Aetna, what would they go, what would be the process, pardon me, that they would go about to get coverage?
Okay, so whenever you apply with the department, it used to be that you had 30 days to pick, right? However, they have changed that for whatever reason. That as soon as you apply, they assign whomever to whomever MCO. So there's 4 MCOs, so it's like 1, 2, 3, 4, 1, 2, 3, 4. What I say, I cannot legally tell you to pick Aetna. What I do say is look at the value added benefits, and I I can drop the value added benefits for Aetna into the chat. But I would look at those benefits for all the plans and see what makes the most sense. Maybe the health plan has more access to diabetes services or, whatever. And then they would just have to, I think, tell the department that they want, and they can switch. So if Aetna works best for them this month, but 3 months from now, WellPoint works better, they can absolutely switch every month if they so chose. Wouldn't necessarily recommend that because that would be crazy. Yeah, so I think it's just a call into the department and be like, hey, I want to switch.
So when you say the department, do you mean DHHR?
Yeah.
Okay.
Yep.
How about if they don't like have an address to put on file? Like if they're homeless and they don't have an address.
I would love to say there's an easy answer for that. For instance, if they're in Morgantown, they can use Christian Help as an address. I don't know if there's in this sort of like Valley area, if there's a organization that allows people to use their address. Maybe that's something that we should look at. Yeah, because so much is regulated what we're able to do through the state that it makes it very hard to fix some of those barriers.
Absolutely. What we do for addresses here, we use the homeless shelter address, which obviously is not the best. When I was a little closer to Lighthouse, we would use their address. Now we're able to work with them directly and DHHR. We give them, of course, residency letters. They're able to
Right.
go and they're able to get their SNAP benefits if need be, their medical and such. But the homeless shelter here is small in Elkins. There's
Mm-hmm.
not very many beds, and it's almost always all taken up. And again, if the individual doesn't have a substance use disorder, I cannot recommend that they go to a treatment facility or sober living. So that's a real challenge for us. The other thing is it's gotten more difficult to get the phones like we used to.
Yes.
That's been a huge challenge. It's almost, I'd say of the crop of gentlemen that we have, right now, six of them don't have phones, and that's a major barrier because at our behavioral health clinic, we're doing everything from Sublocade to Rexati injections to Vivitrol to Suboxone to psych meds to regular medical care, group support. We have quite a menu, DUI classes even. We work
Wow.
with child support and now. So we're really expanding. And what we found though that's one of the most difficult things is getting the individuals the diagnoses that they need. So as an example, an individual comes out, a case manager calls me, they say, I have an individual being released at the end of the week. I'd like to set up an appointment. My job, of course, is to set the appointment as quick as possible. Um, I try to do the same day they get out. I found if it's 48 hours, I might not see them at all. So I'll set up that appointment,
Mm.
but they don't have a phone. And when we set them up, we're able to send automatic text messages, voicemails, everything's automated so they don't miss their appointments. They don't have a phone. I don't see the individual, and we're back to square one. And the next thing I know, I'm looking at the mug shots from the night before, and there's the individual that had an appointment, and it's heartbreaking. And I know that Jillian knows, how difficult these situations can be when your hands are tied. You're trying to help these individuals, and there just isn't really enough. And what we want to do here in the Elkins area, and I don't know, Jonathan, if you can talk on this or if it's all possible, but we would love to get a couple more reentry navigators trained down here and or have the simulation where the different it's a day in the life of a person that's getting out into reentry and there's the different stations that are set up.
I I know that the Martinsburg Reentry Council is supposed to be holding a reentry simulation September of this year. I'm not sure the exact date. and then I think that's at Shepherd's College. And then Bev just had me send out a email. Let me see if I can find it. It's on the constant contact uh, for another reentry simulation. Let me look. Let me look here real quick.
Okay.
But yeah, housing. I mean, because I'm on the getting out app myself, and housing is one of the major barriers that I've seen for people coming out. Uh, I had a guy. Uh, I want to say he was in Huttonsville,
Okay.
but they denied him. Uh, he was trying to go to sober living housing, and they said, "Well, no, you've been in jail for 5 years. You don't have a substance use disorder." And so they denied him going to, I can't remember which house that he was supposed to be trying to go to. So, even sometimes in the prisons and stuff, they stop them from uh going, getting the treatment and stuff that they need. Uh I mean, I've been in prison myself, and people that don't know prisons are naive to think that there's not drugs inside prison. Uh I was in Guam for 23 years, and uh I mean, officers would bring it in. It was everywhere. Let me see. Is this count review?
I know this is the toughest question ever while
Okay.
Jonathan looks for that, but I did want to ask, the one individual that I have that has the sex offense charge, I'm concerned about him because he needs to obviously communicate with the state police. Now, I have given them my name. They have called me. Unfortunately, we thought we had placement for the individual, but they asked for his record. I got an ROI, sent it out, and they denied him based on the severity and the age of the victim. Why I'm coming up, excuse me, why I'm concerned about this is that he cannot stay with his family. And that happens a lot. These individuals come out, they can't stay with family because of some charge that's already happened, or maybe some behaviors that they haven't addressed. And now we have an individual that's on the edge once again. So I'm pretty concerned about where I can place him. If anyone has any idea of where I might be able to get housing for this individual before he gets removed from his parents, please do reach out to me and let me know. It's always tough. I do want to help the individual, but there are laws, there are rules, and we have to follow those. And there's not too many different options for him. I'm just worried about him reoffending and ending up locked up again, to be honest.
You might try the Clarksburg mission. Um,
Okay.
I have in the past volunteered there, and when I was there, they did have a participant who wasn't substance involved, but did have a sexual offense in their past. He was a young kid though, so I don't know, like 2021. So I don't know if that was the exception that they made to kind of like help him into adulthood and make that transition, but it's worth taking a shot.
I think so. I did reach out to them a couple. This has been going on for about 2 months. I did reach out to them a couple weeks ago. They did say that they could possibly work with him, but uh, the Clarksburg mission is often full, and that was the case. They said they didn't have a bed available at that time. But I'll definitely reach out to them again. Thank you.
I put that reentry simulation in the chat. It's at Concord College in April.
Okay. Thanks, Jillian. I appreciate that.
Who, um, Who runs the reentry simulations? Because Concord's just, I mean, below Elkins, sort of, kind of, not really. But if like they could do it one day and pop up to Elkins the next day, that might be cool.
Yes. We had clearance for the Phil Gaynor Center to do it. We just weren't able to organize it to get someone yet from Reach to do it. So we have the space. It's just a matter of, for our community, really does need to see the barriers that these individuals have. They're warming up to reentry. They're warming up to the things that we do. They're warming up to the sober livings. They're warming up to our behavioral health clinic, but there's still a lot of stigma. And the stigma and the discouragement is something that unfortunately I get to see every day. It's really hard to look someone in the eye and you know they have a hard time getting to their appointments, and then something happens with the family, and now the individual's not keeping the ratio of therapy to medication that we have as a law in West Virginia, and now the patient's discharged and displaced. One thing I always do is if we do happen to turn someone down, I work very hard to get them a strong, warm referral to another organization. I think it's super important because again, these people are they're at such risk, and any little thing can push them over the edge. But thank you very much, Jillian, for the information, for the list, and for the suggestion of the Clarksburg mission. The shelter is here. It's just pretty small. Pretty small. So what I
Uh,
did want to let everyone know, and Jonathan, I'll give you the floor in just one sec, is if you do have any men 18 to 65 that are looking for a sober living bed, there are 2 beds available in the Elkins area. So please feel free to reach out to me. I'll get you in touch with Miss Samantha Ryan. Go ahead, Jonathan.
Ayla, on the flyer, there is a contact there. I'm not sure who they are. Uh, like I said, this was uh, a picture of flyer that my boss had sent to me and asked me to run it out into our constant contact that we have. Uh, so I'm not exactly sure who is running it. I just know that it's at Concord on the April the 14th. And then, like I said, I know Chelsea Garcia, who is our chairperson of our Martinsburg Reentry Council. She has one coming up in September at Shepherd's College. And I guess it's kind of late, but we're doing I'm going to be in Parkersburg tomorrow. We're having our reentry navigator training. So I think there's like 16 people involved with that.
Well, that's pretty awesome. If there's another training, though, keep us in mind down here. We could certainly use more people in the field. No
Yeah,
question about that. And the interest is here.
sure will.
Uh, is Miss Brown in the room? Danica, can you hear me? Hi. Are you able to take the mic? The reason I'm asking is the last time there
Oh,
was a meeting.
she's
Oh, you're
finishing up a
finishing up a
call.
call. I see. Okay. Quick question for the room. Does the navigator's number for insurance still work?
Yes, I had a client who we were trying to get, or a person we were trying to get into recovery. She had Kentucky insurance, and we was trying to get her. I can't remember exact. Veltex is where we was trying to get her.
Okay.
And then when the Veltex realized she had Kentucky insurance, Harmony Ridge was the only one that accepted that insurance that she had. And then when they try to enter her ID number, come to find out it had expired. So she has no, and then, so the husband and her were, I gave them the navigator number and they were able to get insurance like the next day. And this has been like 2 weeks ago.
Oh, okay. I did refer it out yesterday. I was hoping that it was still as effective as it was before. Less people. I can imagine there's been so many cuts with grants. It's not even funny. Significantly less people to answer the navigator number. Yes, I believe that.
I also saw a flyer from West Virginia Sober Living Systems
Yes.
that they are putting together a kind of like a PRSS cohort, but it's a reentry cohorts. So it's kind of under the same umbrella of like what a PRSS is, but they're doing it to where it's for navigator reentry.
Oh, okay.
But I think it was I guess they're going to do a trial thing because it's only for Region 4 right now.
I have a contact there. I should reach out to her. That's interesting.
Taking off my Aetna hat because I can't talk politics and be an Aetna employee, so I'm not an Aetna employee. The rural health transition funding, that proposal has a lot of language around peers. It doesn't explicitly say reentry or substance or whatever. And I don't know what's going to happen with that funding. I think it's going to get very political very fast. However, what I have been advocating in many meetings is using that language to kind of say, "Hey, look, we're supporting this thing." Um, so I'm going to drop that. It's dense. It's really hard to read because it's written like I would have written a paper in undergrad. But I do think it's worth looking at the language.
So I may sound ignorant, but I'm just going to ask. So the information you're putting in the RHP West Virginia Project narrative, would an individual be able to access that, or do they have to be a nonprofit organization? Do you know a lot about that?
Well, why did that link just put in text? This is silly. Oh my gosh. Um, so this funding is what the answer was to the budget bill that came out in the summer that cut a lot of our rural monies for hospitals and whatnot.
Yes.
And there it goes. Um, so this money is not even going to touch what's estimated to be lost, which is unfortunate. But I think the funding is going to go to nonprofits in general, but the a lot of the language is based on getting back into the workforce, being healthy in the workforce, not being an active addiction so you can be in the workforce, right?
Yeah.
So there's very clearly an underlying narrative there, but I do think that in looking at grants and looking at projects and looking at whatnot, leveraging that document and saying, hey, this is what you all want, this is what you said you want, you know.
Yes, I totally agree with that. I've done some grant writing recently. Actually, I shouldn't say recently in my prior role. And the narratives that I was writing were certainly for employment, more skills. I mean, this is the information, just like Miss Matthias said, that they said that they want. And I was successful with a small grant of $5,000, and it was based on the needs of men that were in recovery they need birth certificates, ID cards, college transcripts, things such as that, toiletries, all of and we were awarded some money with that. And from what I was told, it was the alignment with the narrative that they say that they're wanting. They want people not only to get clean, as they say, but they also want them to learn new skills. And frankly, from what I heard from a legislator, he said we want them to be taxpayers again. So,
100%.
right.
100%.
What was the question that you wanted to ask?
Hey, Miss Brown, good to see you
Hey,
again. I want
you
to
too.
apologize to you from the last meeting last year. You had asked me a question right at the end, and I was trying to get it off of mute, and then
You're fine.
I'm
You're
sorry.
fine.
I tried to find your email to apologize, everything. I couldn't do
You're
anything.
fine. You're fine.
What I was actually wanted to ask you in particular because I know that you're with corrections, yes?
Yes,
Okay.
sir.
I get calls here. I'm with RRG Behavioral Health, and I'll get calls from case managers, from individuals that are coming out. One
Hmm.
of the problems that I'm starting to run into again is the insurance isn't being turned on at the jail like it used to be by the time or the facility by the time that they get out. And then the other issue that I'm running into a little bit is that the case managers don't happen to have all the information. So if I'm released, let's say Friday, I have my appointment to come here for behavioral health services on Monday, and I don't show, I have no way of getting back in touch with the individual. So what I'm concerned about, Miss Brown, is an
Hmm.
ROI. Like, I know they're calling, but it's a lot of discussion back and forth. And I'm a little worried on our end because behavioral health is super, super regulated, as I'm sure everyone
I,
knows.
w- I will say this. At Western Regional Jail, we do have a mobile unit
Okay.
that has services through Prestera. And there is another unit that's done, I think, in correlation with the Potomac Highlands Guild in another region. So the key would be to make sure that the resource that you're connecting them to is connected to a facility,
I see.
because we in our medical department they keep tabs of the Medicaid signups, but depending on the recovery and the mental health services, sometimes WellPoint may work better than Aetna, because Unicare changed the WellPoint, of course, and then you
Yes.
have the health plan. So depending on the insurance that they need to cover their needs, they have to make sure that they sign up for that supplemental portion. And the issue is a lot of times they won't let them fully sign up for that part until they're released. Like they'll have the actual Medicaid, but that
Yes.
actual supplement that they need to make sure that they sign them up for that before they leave. And me personally, I've been able to help some people get that done, because you have to make sure that you get in touch with the case manager or the counselor at the facility to say, this is the number I need you to call to help get them signed up for this before they're released, to make sure that they know what it's for their home plan, because they have to speak directly to the offender to do
Oh,
that
okay.
portion. Now,
Okay.
the Medicaid part, we can put in all their information that we have, the address they're going to be home planning to, their date of birth, all that information. But to do that supplemental plan, whether it's the Aetna, the WellPoint of the health plan, they have to speak directly to that individual.
I see.
And that's a policy that they've had for a while, because I even called to say, okay, hey, this is what I need done. And she's like, well, we need to speak to that individual directly. So I gave information between the insurance entity and the contact at the facility, and that's how we were able to get it done.
Okay.
And like you said, that is a big barrier, because especially in the jails, you have to work around, if it's count, different things like that, to bring
Yes.
people up to make those phone calls. Whereas in prisons, most of the time, there's unit teams that are right there near their housing unit. So it's easier for them to pull them in when they need to sometimes.
I see.
But yeah, they have a specific policy that they have to speak directly to the person signing up for those benefits.
I did not know that. That really
Because
helps.
And in the work release environment, for example, because I used to work in a community facility, that's how I would get the people that were housed in my facility signed up, because even though they were still in the facility, they went out to work in the community and they went to doctor's appointments.
Yes.
I helped them sign up for that supplemental. And then before they were released, you just have to change their services to the county they're being released to. And
Okay.
then their services continue in that county. But if they stayed in Cabell County where this facility was, then they would stay active in Cabell County.
That makes sense.
Yeah.
Very
So
valuable.
those are the dots that people miss that have to be connected. You have to have it switched to their county, because what helped a lot too was being at the work release. I could take um, residents to Prestera on Route 60, and because they had a liaison there from DHHR, I could take them into her office one at a time and she could sign them up to make sure they had the right benefit. So that way, before they had their intake appointment at Prestera to see their psychiatrist and do those type of things, she made sure that they were properly signed up from where they came to me, to make sure that it was active and they could go receive services. Because even though we sign them up, we don't see Medicaid's database. So to have an actual representative from Medicaid helped make sure that we had instant results. So it's definitely about having a good liaison in the community and having the teamwork aspect of completing those tasks. Because even with housing, when I heard Jonathan talking about the recovery housing, one of the issues with some of them saying that they lack the clean time because they've been in a facility. Some recovery places want to accept people that have been in RSAT, or residential substance abuse treatment, because
Yes.
they know that they're actively working the steps. Now, for people that are in facilities that don't have that, for example, if you're in the goals unit in the jails, you have to be sentenced there by your judge. So that means before you even make contact with the actual prison system, you're sentenced to goals by your judge. If you complete that program, then you might be released back in the community and you might have a treatment plan, things you need to follow. But if you're remanded to our actual custody, then you finish your sentence in one of our facilities and then you're released. And sometimes they may have to complete RSAT if they weren't successful with completing goals. So sometimes you may have people that have, the non-residential classes like the SABISA relapse prevention, but need that in the community to maintain their sobriety.
Yes.
And that's what some recovery places don't understand. Because we have people in our facilities that are on medically assisted treatment. So when they're released, we make sure they continue that and send them to places that help with that. But not all recovery places understand that aspect. Because you may have some programs that say, okay, we're 28 days, but if we're talking about a home plan, adequate housing, it has to be longer than that. So some places that are 28-day transition them into a permanent place, but then a lot of them don't. And that's one of the barriers that they run into. And then, of course, if sex offenders have substance abuse problems, most of the time, recovery places can't take them because of the family unification part of their program, which means that
Yes.
children, family visits occur on the property. So that's a lot.
Thank you, Ms. Brown. That was a lot of great information. I'm kind of going to circle back on something that you said, but Jonathan has his hand raised. Go ahead, Jonathan.
Ms. Brown, so if the program that they wanted to go to, or so if it only is a 28-day program, could that be why he was denied to go to a facility, because they didn't have, okay,
Yeah,
that helps.
because if it's short term, they're saying, okay, in 28 days, where is he going to live? They gotta
Okay,
have they gotta have it already set up. Okay, he's here, but after 28 days, this is where we're sending him. They have to have that guaranteed, because if not, they're in that 28-day facility, and then our parole officer is going to have to find somewhere else for them to go, or they're going to have to start the process by reaching out and saying, can you see if a permanent place has a bed?
Okay, so that makes more sense. I mean that I could see that now, uh, and it would kind of give me a better idea of the places I need to find for the guys coming to me for home plans and stuff like that. So, thank you for that.
You're welcome. What was your other question? You said you were circling back to something.
Mine's more of a comment. So the way we have it set up is that RRG, Recovery Resource Group, we're the behavioral health component. We're the component for the treatment plans, case management. We do all of that. So the case managers will call us from a facility and they'll set us up with they'll set the individual, I should say, up with those services. But what we try to do to take it to the next level, like you said, that I think is missing, is to work with the sober living to give that augmented aspect of what they need to become a whole human being again. And that's, I think it's a great advantage that we have. Though, of course, according to state law, we don't mandate them to come here. They have choice. But we, of course, love them to come to our facility. But we take care of that because we know it's a huge deal. And if the program, like that program that I'm talking about, the sober living, it's a 9-month program. But today, with the IOP, just as example, the individuals are here from 9 to 10, then 10 to 11, and that's the whole house unless they're working. So we have individuals here right now to fulfill that need.
That's actually good because some recovery places don't want to deal with both aspects, the mental health and the substance abuse. And like you
Yes,
said, in order to be a healthy individual, your mental, physical, spiritual, and emotional health have to be taken care of. And a lot of times, people who are in recovery are using as a result of some trauma they might have experienced, which is where the
absolutely.
mental health comes in.
Yes.
And a lot of people don't want to do dual diagnosis, but it's very much a big part of recovery in our state and in general.
Absolutely agree with that. Thank you. I don't have too much else. Is there anyone else that has any information, upcoming events that they'd like to shine the spotlight on?
Oh, I just realized that Miss Jen was on here to speak back to what Jonathan was talking about with the 20-day, 8-day program. Sometimes, depending on the situation, Jen may even help be able to find permanent placement in some of those situations. Because remember, on the meeting we were on before, she said if we needed help with that and she could be a help, she would. So she could be a resource for that also.
Yeah, we can always be a starting point if they need mental health stabilization or detox. And we're a short-term stay, so we work on discharge planning as soon as they get here. But yeah, we could always be a starting point if they meet criteria.
I have nothing but good things to say about your facility, Jen. We continue to use it and has totally been an excellent experience for us. So thank you so much for all the support you've given us.
Thank you so much.
Jillian, I also did get your email, so thank you so much. I'll reply to you a little bit later today.
All
Appreciate
right.
that.
You're welcome.
Well, if anyone has anything else, go ahead and step forward. Can give you back about 10 minutes of your day. Other than that, I really do want to thank you, though, all for showing up. Next month, we will have our guests again. We'll start to kick back into reentry pretty deep. As I was talking to Jonathan at the beginning of the call, what I'm going to try to start doing, if it's at all possible, is to get more individuals on these calls that actually can benefit from the services. I think that's the next step in this. I had one time last year, some people from Sober Living that listened in on one of our calls and they were fascinated. They're like, I didn't know any of this stuff. And that's been my challenge for the last year is just to get more people that could actually benefit from all of the talent that's on these calls. to actually hear about what we have to offer. So that's going to be Samantha and my focus for this year.
Uh, on a side note on that there, the so like I send out the constant contact emails and everything. We have at minimum anywhere from 25% to 33% open rate on our thing. So I think a lot of people are just they see the email, they don't even open it, or they don't. Then so because like I send out on a monthly basis roughly about 1,200 emails a month just for the reentry councils, and a lot of them don't even get opened. So
Normally, when you send those links, there's always a part where you can connect it to your calendar. So
right,
usually when there's a meeting going on, I always get an alert before it starts if I'm able to attend by doing that. And I don't think everybody thinks to do that because it makes it easier and sometimes it helps you
right.
remember.
Um, I'm trying to remember to do this in these reentry council meetings. It's been kind of brought to our attention through Jobs and Hope that sometimes when people are trying to reenter and they're not fitting into these categories to be put into one of these recovery homes, they're looking for independent housing. Yeah, they're going to be out on their own. And they have a disability, they're having difficulties finding places. So what we're trying to do is make sure to get the word out there about the centers for independent living. And those centers are, they are broken down, by region. There's three of them in the state, so the state's broke up into three regions. You can get on the Silk, SILC website, and you can see the map. Please make sure to type in West Virginia Silk, because if you just type in SILC, it takes you to some chemical company. Um, or just type in West Virginia Center for Independent Living. But what these places do is they can offer um transportation to doctor's appointments and things, and these are disability accessible transportation. Grab bars and showers, ramps for people to be able to get in and out of their homes. And it is disability related, so they do, you do have to have these physical disabilities that but the goal of the Centers for Independent Living and Silk is to keep people living as independently as possible and not be put into nursing homes. And they offer loads and loads and loads of services. One of the pushes right now with the centers is veteran services as well. That's something that's been kind of new with them this past year. So we're just trying to make sure that people are aware of them.
That's really interesting. I'm going to pass that on to the peers here. There was a person in particular I was thinking about while you were speaking, and I tried not to do that because I'm not paying attention then, right? Started getting excited. But I think that that's a good idea to pass on to our peers on staff here so they can have that for our community clients. And they're not really aware of it. And then we, of course, have individuals that need to file for disability. And that's happening 2 or 3 times a month at this point.
Um, the centers would be a good place to call. I don't know. Social Security has some really strict rules about who's allowed to assist people
Right.
apply for disability.
Right.
The centers would actually be a good place to call to see locally who someone can go to.
Okay.
Um, I know your family resource networks in each county can assist with that. Um, but I would also call the centers to see if there's anybody else, because the only thing that I can think of is the Family Resource Network, which each county does have an FRN. It's just how it runs and hours and things would be different, but the local resources would know the best. Ayla, I have no idea if legal aid can assist with that or not. I know Disability Rights of West Virginia is not allowed to assist people to apply for that initial. Yeah, I know. Um,
What about the Division of Rehabilitation Services?
DRS,
Hmm.
I do not, if they do that, I'm not aware of it. As far as I know, DRS is only there to assist people to overcome barriers to employment.
Yes,
I
that's
know they
my
help people
understanding.
with educational IEPs too. Most of the
Yes,
time,
that,
if a DHHR office is closer than Social Security, they often help people there as well.
yeah, Social Security really likes for people to come to them with that initial filing. Now, we can assist, let's say you have an individual that has a rep payee, and a lot of times rep payees are family members, and you're hearing, Uncle Jimmy's not giving me grocery money, or Uncle Jimmy's not paying my electric bill. Um, then that's when that individual would call us and tell us what Uncle Jimmy is not doing or doing. Because we are that, for lack of a better description, first level of investigation into rep payee not doing what they're supposed to be doing. We have two of those advocates. They operate in a world of their own with Social Security. And what they do is they gather up all the information, bank statements, everything. They do it all. And then they present that to Social Security. And then Social Security decides what the next steps will be. Um, I work a program called PABS, which is Beneficiaries of Social Security. That is also under a world unto its little self. Because that is beneficiaries of Social Security that have a barrier to work. So they have to be a beneficiary of a Social Security benefit, whether it's SSI, SSDI, whatever. They have a barrier to work. Maybe it's an overpayment. Maybe they need some assistive technology, whatever that may be, and they're just having difficulties finding that or doing that. That's when they would call us. It lands on my desk, and then I'm trying to help this individual overcome that barrier to work. Um, and we have other programs that are specific for different disabilities and different issues, but those are the two Social Security related programs. Um, yeah, those centers for independent living do a lot more than what people realize.
So that's good information. I know that I have a contact in DRS here that we work with. Last year, we were very successful in getting people to go to the DRS office and actually get the diagnosis of substance use disorder. Um, that's a lot of people don't know that you can do that. And obviously, like you stated, it has to be a barrier to employment. Like that's the
Yeah.
main focus for them. But the funding, of course, once again got messed with. And so they were only doing people that were on, I think it's tier one, and that's like a hearing loss or eye loss or, a limb being missed, something like that.
I have updates on that too.
Oh, you do? Okay.
Yes, it has been officially announced just like 2 weeks ago. I know I sound way too excited about this. Um, the order of selection is coming to an end unless apocalypse happens. Um, the order of selection will be coming to an end March the 1st, and all categories will be opened back up.
Awesome. That is good news.
So that the first thing they're doing is they are going through the wait list. That's going to be first. And they are already contacting people on the wait list in category 2,
Okay.
to go ahead and start getting those processed, and updated, because some of these people have been on the wait list for a year.
Yes.
And so, that's the first step. And so even though it's not officially open, like officially, they are already calling category 2 people to get those kind of rolling? Oh, that's a good one, Danica. Thank you.
I just found that I Googled in what we were talking about,
Mm-hmm.
and DHHR actually has a link where you type in the name of the county and it shows the resources in that county that help people sign up for Social Security.
I am going to save this because I get asked frequently if
It's
disability rights can help. So I can tell people about this website.
when the screen comes up, it says that it's a SSI, SSD, and contact
Mm-hmm.
list. And then you just click the box and pick the county that you want to look at, and it gives the resource.
Okay.
That will come in handy. Thank you, Miss Brown. All right. Well, it is 11:01. I really appreciate the spirited discussion today. I learned a lot. Again, there's just such great experts on these calls, and I just want to get this out to more people. We will, of course, be having a speaker next month. If anyone else has information or some of the questions that I came up with, feel free to get in contact with us there. Thank you so much all for attending today. I hope you have a wonderful Wednesday, and we'll see you next month in February on the third Wednesday of the month. Okay. Thank you.
Have a good weekend, everyone.
Thank you.
You too.
And Miss Brown, the it will go up on the YouTube page in about an hour.
Okay. Thank you.
You're welcome.
Thanks, everyone.